Medication and therapy in the treatment of mental illness. Introduction will examine the types of medication prescribed to help with psychiatric conditions, including antidepressants, antipsychotics, sleeping pills, and mood stabilizers. Some alternative forms of therapy will also be covered. We'll cover the following topics: psychiatric medication, antidepressants, antipsychotics, sleeping pills and minor tranquilizers, lithium and other mood stabilizers, interpersonal therapy, IPT, eye movement desensitization and reprocessing, EMDR, mindfulness-based cognitive therapy, electroconvulsive therapy. Psychiatric medication. Psychiatric medication refers to drugs that are aimed at treating the symptoms of mental health problems. They are not cures. The treatment prescribed will vary depending on what mental health condition the client suffers from. Treatments include antidepressants, antipsychotics, sleeping pills and minor tranquilizers, lithium and other mood stabilizers. Some mental health issues may require treatments from more than one category. Antidepressants. Antidepressants are usually prescribed for depression. They can also help treat bulimia, anxiety, phobias, and occasionally physical conditions. Antidepressants boost the activity of some chemicals in the brain, particularly serotonin and noradrenaline. These are neurotransmitters which pass messages between the nerves and certain organs. Serotonin and noradrenaline help to regulate the mood. While antidepressants lift some people's mood, they do not help everyone. There are a few types of antidepressant. Serotonin and noradrenaline reuptake inhibitors, SNRIs. Selective serotonin reuptake inhibitors, SSRIs. Monoamine oxidase inhibitors. Tricyclics and related drugs. Antipsychotics. Antipsychotics are used to treat mental health conditions which have psychotic elements. These might be schizophrenia, some types of bipolar disorder, and serious depression. Antipsychotics may also occasionally be prescribed for severe anxiety and physical issues such as nausea or balance issues. Low doses. Antipsychotics are aimed at reducing the symptoms, which include hallucinations, delusions, confusion and muddled speech, mania, and violent behavior. There are two types of antipsychotics. First generation. Mostly developed in the 1950s, these are also called typicals. They are varied chemicals, but they all act in similar ways and have similar side effects. The side effects are often neuromuscular, but the severity will vary depending on the drug. There is also a potential for them to cause sleepiness. Second generation. Mostly developed in the 1990s, they may be referred to as atypicals. They are less likely to cause neuromuscular side effects or sexual side effects than first-generation antipsychotics, but they may have metabolic effects and cause weight gain. Sleeping pills and minor tranquilizers. These are generally useful for people who suffer from severe anxiety and sleeping issues. They are sedatives, which means they slow down the functioning of the brain and the rest of the body. They are not cures for anxiety or insomnia, but they may help treat the symptoms. They can provide respite and help people get back on track. These treatments should be prescribed in accordance with guidelines from the National Institute for Health and Care Excellence, NICE, the British National Formulary, and the Royal College of Psychiatrists. The guidelines state that these medications should only be prescribed in the short term. If severe depression or insomnia are affecting the client's daily life. If other treatments such as cognitive behavioral therapy have not helped or can't be used. Lithium and other mood stabilizers. Treating conditions such as bipolar disorder, recurring severe depression, mania, and hypomania can be done through mood stabilizers. These are psychiatric drugs that are used for long-term treatment of these conditions. Mood stabilizers include asenapine, carbamazepine, lamotrigine, lithium, valproate. Though these all come under the heading mood stabilizers, they are chemically very different from each other. However, they help people stabilize their moods and avoid extreme highs and lows. Interpersonal therapy, IPT. This is a short-term therapy. IPT focuses on treating depression and has 4 main areas. Unresolved grief. Grief which is delayed and experienced long after the loss, or which results in odd symptoms. Role transitions. If a person's role changes drastically, they may experience depression or have difficulty coping. A role change is usually due to a major life change, such as death of a loved one. Role disputes. When the client's expectations of their role differ drastically from the expectations of important people in their life. Interpersonal sensitivity. The client has problems creating and maintaining healthy relationships. What does IPT involve? IPT usually involves 12 to 16 one-hour sessions. The first 3 sessions will generally be spent collecting information and working out the focus. This will involve looking at key relationships, which will be categorized according to the above 4 areas. Sessions 4 to 14 will focus on helping the client improve the problem areas which are being focused on. The final 2 sessions focus on ending the therapy. This may provoke a sense of loss in the client, sometimes associated with other past losses. The individual may learn about how they deal with loss. The client's progress will be reviewed and the future discussed. Eye movement desensitization and reprocessing, EMDR. This type of therapy is often helpful for individuals who have PTSD. People with PTSD will usually suffer flashbacks of a traumatic event. This therapy usually takes place over 8 to 12 sessions and should be carefully used as it can be distressing for clients. They may wish to have friends or family nearby. Eye movement desensitization and reprocessing therapy involve helping the brain reprocess the recollections of the traumatic event so that the client can move forwards. Mindfulness-based cognitive therapy, MBCT. This therapy is based on focusing on thoughts and feelings as they occur. It is very centered in the present moment. MBCT is often used to treat depression and addiction problems. It combines cognitive behavioral therapy with mindfulness techniques, such as focused breathing and meditation. It is often provided after the depression has been treated to reduce the chances of it recurring. Electroconvulsive therapy, ECT. This treatment involves sending small electrical currents into the brain. This creates a short surge of electrical activity, also known as a seizure. It may help reduce the symptoms of some mental health problems. The electrical currents are applied while the client is under anesthetic. The National Institute for Health and Care Excellence, NICE, recommends this sort of treatment for short-term help if the client has prolonged mania, moderate severe depression not helped by other treatments, catatonia, staying in one position or making repetitive movements, severe or life-threatening depression. Is ECT effective? It's still unclear how ECT works, and there are many different theories about it, but we don't really know how it helps with mental health problems. ECT will not help everyone. Why is ECT controversial? There are a few reasons why ECT is controversial. In the past, ECT was used unethically, without anesthetic and often without consent. Some films inaccurately represent it. ECT can also cause memory loss, usually only temporarily. ECT may be offered before other forms of treatment. Some professionals do not believe it is a helpful form of treatment. How to prepare for ECT? Clients can prepare by not eating or drinking for 6 hours before treatment, not wearing metal hair grips or piercings or using hairspray or creams, wearing comfortable clothing, and telling the team if they have cosmetic dentistry such as veneers or implants. What to expect during ECT? Shoes and any metal objects are put in a safe place, and the person is asked to lie on a bed. An injection of general anesthetic is given, along with a muscle relaxant once the anesthetic has taken effect. A face mask or tube will supply oxygen, and the client is given a mouthguard. The ECT machine will deliver brief, high-voltage electric pulses through electrodes on their temples, or on one side of the head. Controlled seizures last about 20 to 50 seconds. Potential side effects. Memory loss. This is common and usually fades, but may be prolonged. Memory tests should be offered prior to starting and after each session. Some people experience long-term memory loss or find they can't remember things after the point at which they had treatment. Some immediate side effects include confusion, headache, nausea, achiness, sleepiness, lack of appetite. Longer-term effects include loss of creativity or drive, loss of emotional responses, apathy, trouble concentrating, difficulty learning new things.